Hello! If you're an expat resident living in Los Cabos, this brief explainer is for you. We're going to talk about heart rhythm, what it is, what symptoms to be aware of, and what a calm, professional evaluation actually involves. Okay, let's get right into it.
So, if you live here, you might have felt it yourself, or maybe you've heard friends talking about it. Those moments of dizziness or a strange feeling like your heart is fluttering or pounding. I want to start by saying you're definitely not alone in this. It's a pretty common experience.
And because these things can pop up out of nowhere, it's completely natural to feel a little concerned or unsure about what's going on. It's totally understandable to feel unsettled when your body is sending you signals you don't quite recognize.
So our goal here today is pretty simple. It's to help replace some of that uncertainty with real understanding. Just knowing when it might be a good idea to get things checked out can give you a sense of control and, most importantly, some peace of mind.
All right, so first things first, let's take a really simple look at how your heart actually works. And don't worry, we're keeping this straightforward, no complex medical jargon, just the basics. Now, this is pretty fascinating when you think about it. Your heart basically has two main jobs. The first one is the one we all know, right? It's a muscle. Its job is to pump blood all through your body. But it has a second, equally important job. It has its own built-in electrical system that tells the muscle exactly when to beat. It's like the conductor of an orchestra.
And that pattern of beats, the one that's controlled by the electrical system, that's what we call your heart rhythm. It can be nice and steady, or sometimes it can get a little too slow, a little too fast, or just irregular.
And right there, that's the key connection. When there are little changes or disruptions in that electrical system, that's what can lead directly to those physical symptoms we talked about, like dizziness or palpitations. It's kind of like the electrical system sending a signal that something is a bit out of sync.
Okay, so with that in mind, let's look at a practical checklist. Now, this isn't for diagnosing anything, it's just to help you be more aware of specific symptoms that might make an evaluation a sensible next step.
So take a look at this list with me. We're talking about things like actually fainting or even just feeling like you're about to faint, frequent dizziness that you can't really explain, palpitations that seem to happen pretty often or just feel really uncomfortable, or maybe getting short of breath doing normal everyday things, and finally, a level of fatigue that feels really unusual for you. If any of these sound familiar, it could be worth looking into.
Now, I really want to pause here for a second because this is so important. A very common fear is that having these symptoms automatically means something serious, like needing a pacemaker. I want to be crystal clear. That is simply not the case.
The truth is, for many patients, their symptoms can be managed in other ways, maybe through lifestyle changes, medication, or sometimes it's just a matter of monitoring and reassurance. And the evaluation is just the first step to finding what's right for you, and very often, that path doesn't involve any devices or surgery.
So, what if you do decide an evaluation makes sense? What does that actually look like? Well, the process is really designed to be calm, clear, and focused completely on you. And this lays it out perfectly. First, it all starts with listening. Your story, what you've been feeling, that's the most important information. Then, there's a review of your overall medical history. After that, if there are any findings, they're explained to you clearly and calmly. And finally, any next steps are planned together, as a team, with absolutely no pressure.
All right, that brings us to our last section. What's a simple, no-pressure next step if you'd like to learn more?
Look, at the end of the day, this is all about getting clarity. If what we've talked about resonates with you, and you feel that just having a conversation would bring you some peace of mind, you can simply request an initial evaluation.
To do that, the most direct way is to get in touch using this number. It's WhatsApp +52 55 3734 3784. And finally, just a quick reminder. This content is for educational purposes. It's not a substitute for a medical consultation. Every person is unique and requires their own individual evaluation.